If you haven't heard about Anchor, it's the easiest way to make a podcast. Let me explain how I found out about this. It's free. It's on your app store. There's a creation tool that allows you to record and edit your podcast right now from your phone or computer. Anchor will distribute your podcast for you so it can be heard on Spotify, Apple Podcasts, and many more. You can make money from your podcast with no minimum listenership. It's everything you need to make a podcast in one place. Please, I urge you, don't waste another minute. I wasted 3 years. I attended all kinds of events to learn all the steps. I was so confused, and it was right here. Download the free Anchor app or go to anchor.fm to get started. Do it now. The latest on the coronavirus. This episode 64, Distrust of the COVID vaccine. I'd like to do some background on what has transpired. The COVID-19 has taken more than 530,000 lives in the United States alone. We marked the 1-year anniversary this week since we went into lockdown and the world changed as we knew it. Today is Saturday, March 13, 2021. For the Heart and Home podcast, I'm your host, Sabah Fakhoury. I hope it's sunny where you're at. The world economy is on track to be back to its pre-pandemic level by June, thanks to the $1.9 trillion fiscal stimulus package passed this week and signed by President Biden on Thursday. The U.S. economy is predicted to expand by 6.5% this year, China's by 7.8%, and in Europe by 3.9%. Meanwhile, the global tally of confirmed cases of the coronavirus-borne illness, COVID-19, climbed above 117 million this week, while the death toll rose above 2.6 million. At least 66 million people have recovered, though. The U.S. has the highest case tally in the world at 29 million, or about a quarter of the global tally, and the highest death toll at, as I mentioned in the open, 530,000 plus, or about a fifth of the global toll. India is second worldwide in cases with 11.2 million and fourth in deaths at 157,000, just short of 158,000. Mexico has the third highest death toll at 190,923, and it's the 13th highest case tally at 2.1 million. China, where the virus was first discovered late last year, has had 101,149 confirmed cases and 4,838 deaths, according to its official numbers. Meanwhile, a study found the vaccine developed by Pfizer and German partner BioNTech is effective in neutralizing the highly infectious new variant that was first detected in Brazil. Research is underway at Moderna, Novavax to get ahead of variants like those identified in the United Kingdom, South Africa, and Brazil. And they're working on a third booster targeting multiple variants. Brazil has the second highest death toll at 266,398 and is third by cases at 11 million. It's been hit by an aggressive COVID-19 variant. Brazil now has the most daily COVID-19 cases and deaths in the world. Brazil's 7-day average daily death toll has risen to 1,573, while the rate in the U.S. is plunging down to 1,566 a day, amid fewer cases and more vaccination. Chile's vaccination campaign has put it on course to become the first developing country to achieve herd immunity. Your geography is important because it determines what you can expect. While all lives are valuable, not all will receive the same care. The handling of the pandemic could affect the outcome of upcoming elections, just as the 2020 U.S. presidential election in part cost Donald Trump his office for his mishandling of the coronavirus. Remember what he said? It was all under control. Well, in Nancy Pelosi's words, his denial at the beginning was deadly. In France, President Emmanuel Macron has ignored calls from public health experts to impose a third lockdown. Instead, the French president has relied on a nationwide evening curfew and other restrictions while authorities try to accelerate vaccinations. Due to new variants there, pressure is rising again on intensive care units in the Paris region, where a new patient is admitted every 12 minutes. ICUs are nearly 80% full. In Germany, the UK variant has caused infections to rise again since early February. Only 30% of Germans trust in the competence of Chancellor Angela Merkel's party. The German press, which initially supported Ms. Merkel's handling of the pandemic, has turned against the government with almost daily publications from the Bild tabloid to Spiegel attacking authorities' competence. In the European Union countries, new COVID cases have been rising again since mid-February. The 27 EU countries are made up of Austria, Belgium, Bulgaria, Croatia, the Republic of Cyprus, the Czech Republic, Denmark, Estonia, Finland, France, Germany, Greece, Hungary, Ireland, Italy, Latvia, Lithuania, Luxembourg, Malta, the Netherlands, Poland, Portugal, Romania, Slovakia, Slovenia, Spain, and Sweden. Britain, which joined the EU in 1973, exited at the end of January of last year, 2020. That country voted to leave the trading bloc in 2016, commonly called Brexit. Johnson & Johnson has told the European Union it is facing supply issues that may complicate plans to deliver 55 million doses of its COVID-19 vaccine to the bloc by the end of June, Reuters has reported. A delay would be yet another disappointment for the trading bloc, which has suffered issues with supplies from other vaccine makers and a slow rollout of getting those needles into people's arms. So far, there is nothing like the acute hospital crisis that overwhelmed healthcare systems in parts of Spain and Italy a year ago. Italy hit a grave milestone, however, of more than 100,000 COVID deaths. Italy was the first country in the world to impose a full lockdown last spring, March 10 to be exact, at the height of the crisis, and is now bracing for a third surge. Now, some Italians are starting to joke that they will be the last nation to exit a lockdown. Italy's recently appointed Prime Minister, Mario Draghi, said that passing that terrible threshold of 100,000 deaths was something, quote, we would never have imagined a year ago, The Guardian reported. The new Prime Minister's first decision, which was confirmed on Friday, was to lock down many regions of Italy starting this Monday, and the whole country over Easter. Another holiday that we're going to be away from family. The decision means bars, restaurants, and non-essential shops will close in many regions, while elsewhere they face stricter limits on hours and services offered. People's movement will be more tightly restricted. Millions of school students will go back to remote learning. Italy's escalation comes after weeks of lighter measures that failed to stop the rapid rise of the UK variant. This all sounds like a repeat of last year, doesn't it? Except for now, we're dealing with another strain. In other news, Japan will stage this summer's Tokyo Olympics and Paralympics without overseas spectators due to concern about COVID-19, the Kyodo News Agency reported this week. The government and the Japanese organizing committee of the Summer Games are expected to hold a remote meeting with the International Olympic Committee and 2 other bodies, possibly next week, to make a formal decision on the issue of whether they're going to have overseas visitors. Back in this country, leading airline and business groups are asking the Biden administration to develop temporary credentials that would let travelers show they have been tested and vaccinated for COVID-19, a step that the airline industry believes will help revive travel, the Associated Press reports. Various groups and countries are working on developing so-called vaccine passports aimed at allowing more travel. Since January, the elderly, namely 65 and older, and vulnerable groups have been eligible for inoculation. We're administering nearly 2 million shots per day, while other foreign countries are struggling to get vaccinations and keep their rate of infections down. As we inch closer to the official start of spring in this part of the hemisphere, virus infections and deaths have been falling rapidly in the U.S. and in the United Kingdom, which has 4.2 million cases and 124,801 deaths, the highest in Europe and 5th highest in the world. As of yesterday, they had vaccinated 22 million people in the United Kingdom, and another 10 million vaccine doses could be available to them within days. The CDC's vaccine tracker is showing that as of 6 a.m. Monday, 116.4 million doses had been delivered to the states, 92 million shots had been administered, and 59.9 million people had received at least one shot, which is equal to 23.5% of the population. A full 31.4 million people are fully vaccinated, which is only equal to 9.5% of the population. So we're off to a good start, but we've got a long way to go to get the rest of the population, and it's targeted that by the end of May, as President Biden announced in his first time address, the goal is by May that everyone will be eligible to get a vaccine, but not necessarily be able to have it available to them, but they can get in line and try to get it. On the front page of today's Wall Street Journal, the headline read, "Europe confronts a COVID-19 rebound as vaccine hopes recede. Contagion is rising again in the EU despite months of restrictions on daily life as more virulent virus strains outpace vaccinations, with a mood of gloom and frustration settling on the continent." We surpassed 100 million COVID-19 vaccines administered, while a reported more than 58,000 new COVID-19 cases and over 1,500 deaths, infections and deaths, which were higher on a per capita basis for most of 2020, have fallen below the EU's bloc. Here's my 2 cents. I just wanted to put in a few thoughts before we start on my coverage of trusting our government officials. Now, in today's Heart and Home podcast, I investigate the stories claiming distrust of COVID-19 vaccination among the African American community. There's compelling evidence for that argument among the Black population who point to historical evidence involving the Tuskegee, Alabama incident that happened from the 1930s to the 1970s, which I'll cover shortly. But I want to caution my listeners, it's not only minorities who oppose getting the vaccine. A recent poll found 1 in 3 adults don't plan to get vaccinated. It doesn't say which adults, which minorities, whether they're white or Black. I've spent months feverishly worrying about how to protect my elderly parents. And now that they've had their first of 2 Moderna shots, and myself, my first of the Pfizer, I reflect on what I've learned as we pass our 1-year mark since our world changed as we know it. As highly transmittable coronavirus variants sweep across the world, scientists are racing to understand why these new versions of the virus are spreading faster and what this could mean for vaccine efforts. New research says the key may be the spike protein, which gives the coronavirus its unmistakable shape. And yet there are still people who just won't believe the science. To protect myself and my parents, I followed one tip that I learned from survivors of the 19 flu pandemic. I took baking soda. Each morning, we began the day during lockdown in March and April 2020 by adding 1/4 teaspoon of baking soda to a glass of water. I believe that the survivors of the 1918 pandemic, the story was maybe a full teaspoon, but it was just a little too hard to stomach, so I just cut that back. But nonetheless, that's what I did. Now, whether it helped or not, I don't know. I did have 2 days where I became ill and was vomiting, to which I thought I had food poisoning. I never had a fever, loss of my sense of taste, or ability to smell. I limited my movement and wore a mask and rubber gloves, followed CDC guidelines on washing hands and other ways to protect myself when getting groceries. Although they said ordering hot food was safe, my family stopped getting carry-out and instead prepared all meals at home. We tried to help local businesses as much as we could, but didn't feel comfortable putting our health at risk ahead of the survival of someone's small business. Fast forward to today, March 2021, as the country is eager to return to normal, whatever that means in a post-pandemic world. I worry about the rush to stop wearing masks, about other variants and strains of the coronavirus, which will be with us for a long time as a seasonal flu, and how we could be better prepared for future pandemics. For the African American community, they remember what happened with Tuskegee. For the white community, they have only a gut feeling that they don't want the vaccine. I've spoken to many friends in the white community, from family members in the healthcare industry to workers at my dental office and others in service industry. More are opposed to it than for it. They're mostly young, less than 50 years old. But here's what I wonder. Why the slow start and why the botched vaccination rollout in America? Poor communication, vaccine supplies misallocated, and incomplete federal fatality figures. Why did the government, ex-President Trump excluded, choose to vaccinate the elderly, over 65, after healthcare workers, first responders, and teachers? The death rate didn't only affect the elderly. There were many people who died that were in their 30s, 40s, and 50s, and some children. If we follow the science and the numbers, it would have made sense to follow what is normal practice in the medical profession. If a patient comes to the ER, a doctor is taught to focus on helping, for example, a 40-year-old patient rather than an elderly patient. For the obvious reason, the latter, they've lived their life. So here, we wasted months and valuable time leaving the rest of the younger population unprotected. We also saw the blunders with the lack of supply and poor distribution since February 2021, which is very sad and disheartening and frustrating. Once the first of the 3 current vaccines became available, people who wanted them couldn't even get them fast enough. I'll get back to those who don't want them in a moment. The point being, those who oppose the vaccine think we're crazy for getting the vaccination because the obvious reason is we don't know the effect of it long term, especially because it was made, some say, too fast. Well, insert a slow, shocked Oprah, "What?" here. Researchers developed an engineered version of the COVID-19 mutation and found that blood samples taken from people who received the vaccine were able to neutralize the variant, according to the study published in the New England Journal of Medicine on Monday this week. The study conducted by the companies along with scientists at the University of Texas Medical Branch found the vaccine was roughly as effective against the Brazilian variant as it was in acting against the original virus. Earlier studies found that the UK and South Africa COVID-19 variants were also neutralized by the Pfizer vaccine, although the South African one is understood to reduce the protective antibodies that the vaccine produces. Pfizer is planning further research. Separately, early data from a Brazil study found that the vaccine developed by China's Sinovac Biotech Limited is effective in dealing with the Brazilian variant, according to Reuters. All I can say is we each have a choice. It's up to the individual to decide. While we've seen images and news coverage of the president and vice president, Anthony Fauci, doctors and nurses as the elderly getting it, now we have Dolly Parton, who spent $1 million of her own money to help develop the Moderna vaccine, to LeBron James saying it's a private matter and refusing to endorse getting the shot. Here's a fact. Only 50 people are known to have contracted COVID-19 more than once. But new strains have medical experts on high alert, despite assurances from the drug manufacturer that approved vaccines protect against new variants. There is just too much confusion. People don't feel safe. They're not sure what to think or do. All I can say is, in honor of the 530,000 plus people who we didn't have to lose to this pandemic, it would be wise to protect yourself. There are no guarantees in life besides taxes and death. You have to pay them, and you're going to be around, and you're not going to be around forever. However, because of this pandemic, life expectancy is shorter. Quality of life is interrupted. Mental health has been affected, and financial ruin is a reality for millions of Americans. With each pandemic, we've lost people, while with each event, we learn how to do things better next time. No one knows what tomorrow will bring. Waking up is not guaranteed. The world can't meet demand. The supply is limited. Whether you want it or not isn't the real question. What you should be asking yourself is whether you can afford to take the chance with your life. This week, a year after the agency had largely banned nursing home visits as the coronavirus pandemic took hold in the U.S., federal regulators lifted restrictions on visits to nursing homes after widespread vaccination helped sharply reduce COVID-19 cases. So that's going to make a lot of grandparents happy so that they can see their loved ones and their grandkids, and people can start visiting each other. I hope to visit my aunt as well, who's been in a nursing home here, and we've been prevented from going to see her. So today we're on a road to what some might call normalcy, but not because of politicians and media. Our thanks lie with the medical personnel who treated patients and discovered treatments on the fly, and private vaccine developers. Thank you, healthcare workers. Without you, who knows what we'd be facing today. Now, as our economy begins opening up, we're going to become a society of haves and have-nots. Those with the vaccination and those without. You heard me mention in previous episodes of the Heart and Home podcast that a recent Associated Press poll found 1 in 3 Americans don't plan to get the COVID-19 vaccination, and that the Ad Council plans to launch a 52 million public service campaign targeting mostly Hispanic and African American population. And aiding them in this effort will be the churches and local leaders within their communities. In a February 24, 2021 report in the Financial Times, people were quoted as saying, COVID-19 is a man-made disease invented by white people to subjugate African Americans. Some of those same people also said there are a lot of pandemics in this world. Why are we focusing so much on this one? It's because they want to control us. COVID plants fear in your mind, and social distancing is how they control you. This is what people really believe. Well, you know what? I loved staying home. So I don't care what people think. I thought it was a time for us to rest, to rejuvenate, to take care of each other, to reflect. And for me, I welcomed the downtime. Now, admittedly, here in the United States, the disastrous handling of the disease has incurred a higher national death toll from the virus than both world wars, the Vietnam War and 9/11 combined. It's affected certain communities more than others, and scientists believe it gets as many people vaccinated as possible. Yet, there are many people who believe the unprecedented success and speed of bringing them to market has caused vaccine hesitancy by many in the African American community and others within the greater American public. However, for some reason, the government is focusing on persuading African Americans that vaccines are safe. Black adults are one of the groups most worried about being inoculated. In a January study by the Kaiser Family Foundation health think tank, 43% said they wanted to wait and see before receiving a vaccine, compared with only 26% of white Americans. So there it is. It's almost half of who they polled. And again, a poll is not accurate. It's just an indication of contacting so many people, and then they say, okay, I talked to 10 people, and therefore we'll just say that the rest of the population is going to think this. And well, we don't know exactly how people think. Again, it's just a survey, an indication, and it does show that both blacks and whites, not all, want to get the vaccine. Data from the U.S. Centers for Disease Control and Prevention, the CDC, show that while African Americans make up 13% of the U.S. population and account for 15% of COVID-19 deaths, they constituted only 6% of those who had been vaccinated as of mid-February. But the pandemic has underlined the problem. U.S. government data show Black people are 10% more likely to contract coronavirus than white people, 3 times more likely to be hospitalized with the disease, and twice as likely to die. Many African Americans want to know whether they can trust their government. And over the past 4 years, they have watched former President Donald Trump tell a white nationalist group to stand by in the run-up to the election, oversee the tear gassing of Black Lives Matter protesters outside the White House and the U.S. Capitol, compared to very few people at the January 6th insurrection of pro-Trump rallies, and downplay a pandemic that hit their community harder than any other. But concerns over the intentions of the U.S. government go much deeper than current events. Many refer to the 20th century medical experiments on Black people, to reports of smallpox-infested blankets deliberately being handed out to Native Americans in the 18th century, and to the arrival of African slaves in America as far back as 1619. When U.S. President Joe Biden took office in January, he promised to make healing the country's racial divide a priority, along with dealing with the pandemic. But people don't only distrust the government for its poor response to the pandemic. They also distrust health authorities. So how do you build trust among a community? They're using the church and its leaders in the community. To understand why many Black Americans distrust the U.S. government, they remember what happened 90 years ago in Tuskegee, in Alabama. In 1932, officials working on behalf of the U.S. Public Health Service started recruiting volunteers from the farms around the city for a vague-sounding medical program. They approached the men in the fields where they worked, as well as in their churches and in schools. And 40 years later, hundreds of Black families from Macon County found out the men had been part of a medical experiment to track what would happen if syphilis was allowed to progress untreated in the body. The trial did not involve giving the men syphilis. Rather, they were denied treatment, even after the penicillin had been recognized as a safe and effective remedy in 1945, and even if they had become very sick. Now, while the Tuskegee, Alabama experiment was still going on, another incident happened in 1951 with a young tobacco farmer named Henrietta Lacks. She was a 31-year-old mother of 5 who was treated for vaginal bleeding at the Johns Hopkins Hospital in Baltimore, Maryland. She had cervical cancer, as it turned out, which killed her within months. However, during her hospitalization, a sample of her tissue was collected without her knowledge, and those cells turned out to be unique because they survived outside the body and doubled in number every 24 hours. Now, her descendants, they're named HeLa cells, HeLa cells. They live on today and have been used for everything from developing the polio vaccine to helping identify how COVID-19 infects the human body. When Lax's family found out about the miracle cells in the 1970s, they were never offered any of the commercial gain, despite HeLa cells trading today among medical practitioners for thousands of dollars per vial. The Henrietta Lacks story remained almost entirely unknown until Rebecca Skloot's 2010 book, The Immortal Life of Henrietta Lacks. So these are things that are coming to light that the Black community has hooked their reasons for distrust of the government and health officials. Now, today, a number of factors make Tuskegee's 8,500 mostly Black residents vulnerable to COVID-19. They include a high poverty rate, a high share of older residents, and a high prevalence of diabetes. Admittedly, the legacy of the Tuskegee study has made some Black people wary. As officials race to get shots into arms, inoculation rates in Black communities have fallen behind. The current head of the COVID-19 Health Equity Task Force says it's more than Tuskegee or Henrietta Lacks stories. Many people hear stories from friends seeking health care who were mistreated. Another example of inequity was revealed within Alabama's white population getting the vaccine, which was almost twice that of Black people, according to state data. And it's not because African Americans don't want it. State and local officials blame vaccine scarcity and say that they have followed federal recommendations. But critics say they were too eager to get doses into every county and bypassed community infrastructure that could have reached the minority population in places such as Birmingham, for example. So, in comparison, Main Street Family Care got its first shipment of the vaccine before Christmas. Main Street's chain of 17 urgent care clinics, mostly in majority white areas across the state of Alabama, was acquired by Dallas private equity firm Trinity Hunt Partners in September. And that company said it got vaccines because of its reach in rural areas. And it had 5 freezers, and because it was already in the vaccine data system. And it is handling from 500 to 1,000 shots a day. In comparison, some low-income clinics got vaccines once eligibility loosened, but not until February. For example, Christ Health Center in eastern Jefferson County got some of its clientele that includes public housing residents, about half of whom are people of color. But Christ Health hedged its bets and bought an ice chest-sized ultra freezer to accommodate Pfizer doses so that a clinic wouldn't be competing for one vaccine. It cost them $10,000. While the clinic got its paperwork in early, it waited weeks for the vaccine. More than 2 months into America's vaccine rollout, a community clinic that serves the poorest on Birmingham's majority Black North Side had yet to receive its first dose. The Alabama Regional Medical Services Clinic watched the vaccine flow elsewhere, including a pharmacy in nearby Mountain Brook, the state's wealthiest town. Alabama's Public Health Department said less than 20% of COVID-19 vaccinations have gone to Black people in a state with a population that is 27% Black. A recent Census Bureau survey showed Alabama had among the highest percentage of unvaccinated adults who said they probably or definitely won't be vaccinated. 9.2% of the white population have been vaccinated, compared with 5.2% of Black residents, according to the Bloomberg Vaccine Tracker. White residents make up 68% of the population and almost 80% of those vaccinated. Black people make up 26.6% of the population, but only 17.6% of them had gotten vaccinated. Furthermore, many of the 900 clinics and pharmacies in Alabama that were approved to vaccinate are still waiting. That includes half of the community clinics in the lowest income areas. Just this week, Jefferson County, not the state, provided North Birmingham with only 400 doses. But the state of Alabama is not alone in reporting lower vaccination rates for Blacks. Studies have found only about half of states are using a planning tool for natural disasters called the Social Vulnerability Index. Others, including Alabama, are using an algorithm called Tiberius to plan, while it allows localities to request the Social Vulnerability Index data. Alabama has used it mainly to find healthcare workers. Duke University researchers found only a handful of states that included California, Indiana, New Mexico, Massachusetts, Alaska, Louisiana, New Hampshire, Oregon, and New Jersey among them, had robust plans that accounted for the advantages whites enjoy in the healthcare system. Those include better access to information, doctors, transportation, technology, and more time. Perhaps that's why future plans include community leaders and institutions to bring vaccines to familiar locations, as well as provide transportation and alternative ways to get appointments that don't require websites. This has not only put minorities at a disadvantage, but the elderly who don't use technology, leaving their kids strapped with trying to find the vaccine. One young college student in Chicago was on one of the morning shows a few weeks ago because people were reaching out to him to help to get vaccination appointments. Other states prioritize speed over equity. In Florida, Governor Ron DeSantis was criticized because he defended putting pop-up clinics in a wealthy retirement village with predominantly white residents. He instructed them to, quote, go where the seniors are and try to knock it out. In the states of Massachusetts, North Carolina, and Mississippi, vaccines are reserved specifically for minorities, the same in Chicago, where a recent event vaccinated all comers of any age in a neighborhood of undocumented workers. So, which is it? Do they want it or don't they? The Tuskegee situation was different because the men were denied treatment, but they're not being denied the vaccine for COVID-19. Is it that it's not being offered? The state of Alabama also trails the nation in the percentage of its population that's been vaccinated and the proportion of its doses used, according to a Bloomberg analysis. Its data collection has been so poor that it makes it virtually impossible to say how well it has vaccinated its Black residents compared with other states. These are the kind of stories many Black Americans remember, and they are a large part of the reason so many do not trust the advice of governmental health bodies. Some also don't trust the media or public awareness campaigns that included Black celebrities encouraging them. You know, they just don't trust people telling them what to do. Now, I don't know if you feel like if you heard from somebody that you looked up to, whether you would say, oh yeah, okay, they said to do it, so I'm going to go do it. People don't believe what they hear anymore. So it's just something that's unfortunate. It's so saturated that they just don't believe them to be genuine. But you know what? That didn't stop pastor and leader in the Dallas Black community, T.D. Jakes, from penning an opinion piece in February about how prayer and science led both him and his wife to get the vaccine. He talked about how the unfounded rumors about an attempt to use the vaccine to wipe out the Black community had gained, foothold among the fellow African Americans, and he understood the general mistrust. But, he said that the painful truth is that Blacks need the vaccine more than anyone. The Centers for Disease Control and Prevention says we are nearly 3 times as likely as whites to die from COVID. As a minister, I have witnessed these deaths personally. I've buried many friends and church members. At the peak of the pandemic, I regularly received reports of 2 or 3 deaths each day. I have struggled to console and counsel their survivors, most of whom couldn't be in the same room with their loved ones as they took their last breaths. Over the weekend, he continues, I lost an old friend and colleague to the virus. But I believe that God, who brought us through slavery, Jim Crow, the Spanish flu, and the lynchings, can steer us through this crisis as well. He concludes, eventually it came down to common sense. I am a 63-year-old Black man, a little overweight, and with an underlying health condition. The vaccine has been proven to diminish chances of people like me getting the virus. To date, the vaccine's side effects have been minimal or non-existent. It's true that no one knows anything about potential long-term side effects. But here's what we do know. The virus has killed more than 500,000 people in this country alone, but the vaccine has yet to kill a single person. Moreover, there is a great deal of information about lingering, debilitating symptoms among those who survive the virus. I don't consider myself an advocate for taking the vaccine. That is a personal decision. Pastor T.D. Jakes says, but you shouldn't make a critically important personal decision with no information or poor information. In an age when the line between fact and fiction is gradually eroding, it has never been more important to keep people from being swayed by misinformation or by the innumerable falsehoods spreading throughout the internet. He says, here's my unsolicited counsel. Do your own research. Pray. Consult multiple credible sources, from your personal physician to federal agencies like the CDC. Your earnest quest for the truth could save your life and your loved one. For the Heart and Home podcast, I'm Sabah Fakhoury. Tomorrow, I prepared an in-depth look at Oprah's interview last Sunday with former royals Prince Harry and his American wife, Meghan Markle.